presenting her research on Black maternal disparities, a qualitative study of the experiences of Black mothers and medical students with health equity training.
America is not the safest place to birth babies, and it's even more dangerous when you're Black. My name is Saida Wiltz, and today I'm going to be presenting to you, as she just said, Black maternal health disparities, a qualitative study of the experiences of Black maternal mothers and medical students with health equity training. So I want to talk to you guys a little bit about how I got into this. My sophomore year of college, I decided to start looking into health disparities. I am on the pre-med track. I would love to go to medical school one day and become a doctor. And at first it was just kind of the broad sense of health disparities and why our healthcare system is failing Black people. But my junior year, after watching this documentary called Aftershock, I decided to get into Black maternal health disparities, specifically in the maternity ward. So this documentary is really good. It's on Hulu. I recommend all of you guys to watch it. It follows the stories of two Black mothers. They unfortunately were not listened to in their concerns in the hospital and had multiple problems with their pregnancies, one of them after and one of them during. Because their concerns weren't heard, they ultimately died one after the birth of their child and one during the birth of their child. And this documentary is sad to watch, it's hard to watch, but what I took from this documentary is the woman on the left, that's Shamani Gibson's mother, and the man on the right is the husband of Amber Isaac Rhodes, that's the two women's names. And they took what happened to their daughter and their wife, and they created change in their community through storytelling. And that's what I really wanted to focus on, is learn about how storytelling can create change in the community. So after kind of seeing this documentary, I started to get into the literature, learn more about what a maternal health disparities actually look like and why. So this paper by Markin, written in 2021, called Intersections of Gendered Racial Trauma and Childbirth Trauma, Clinical Interventions for Black Women, says, Black women are 3 to 4 times more likely to experience dangerous and even life-threatening complications. Statistics like these are riddled through the literature. You're going to find a bunch of basically statistics on how much more dangerous it is to be Black and to be birthing a baby in America. But you're also going to find a lot of reasons why. And most of those reasons boil down to racism, implicit bias, pre-existing health conditions, and social determinants of health, as well as biological racism. This study is going to focus more on that implicit bias and racism, but I do want to kind of talk to you guys about the other two. Biological racism can be seen just throughout the history of what Black women went through in this country. Many of them were experimented on to further the field of gynecology that we know now. Black women there are still doctors out there that believe that Black people experience pain, a lesser amount of pain or a different amount of pain than white people, and that definitely will affect the type of care that they receive. Also, pre-existing health conditions as well as social determinants of health affect a mother's pregnancy and the way they birth their baby when it comes to just things like high blood pressure or preeclampsia. But also, what's really interesting on the social determinants of health side, Black women that are educated and that are in a higher social class still have worse maternal health disparities and outcomes than white women who are uneducated and in a lower social class. So that is quoted as one of the many reasons why there are disparities, but despite that, these women are still, even someone who's educated and high class, still have worse outcomes, meaning that the common factor in these outcomes is just the fact that they are Black. So, as someone, like I said, who wants to go to medical school, I started thinking about so I have the why, all these social determinants of health, the bias, the racism, but I wanted to, personally I believe that racism is something that is taught, so it can be something that is untaught, and I started to get into looking at medical schools, which is where all doctors have to go to before they become a doctor, and how we are teaching against racism in schools. This paper by Turndrup in 2013, called A Student's Perspective on Medical Ethics Education, talked to a bunch of different medical students about their time in medical school and how they felt with regards to learning about diversity, equity, and inclusion, as well as ethics. So this quote says, "Many medical students have trouble even recognizing that a moral dilemma exists by the time they hit their fourth year or by the time they graduate. Medical ethics courses in medical school only occur during the first 2 years of school. After that, students are peer pressured into getting good grades, into conforming to the norm at wherever they work, and they lose sight of the ethical or moral dilemmas that they could face in like when working with patients." So, as far as what we're missing, it seems to me as if there's not enough adequate diversity, equity, and inclusion training in medical schools. And what I found as a gap in literature is that there's not enough qualitative studies that actually look at Black women and their stories. As I said before, it was Black women's stories that brought about change in New York, where the documentary is centered. And if we're going to teach medical students how to treat their patients better, then we need to be asking the patients how they want to be treated. So, this leads me to my research questions. What kind of experiences do Black maternal mothers encounter in the healthcare setting with healthcare professionals before, during, and after giving birth? And how do medical schools prepare medical students to be culturally sensitive and free of bias when treating Black maternal mothers? My hypothesis to these two questions is 1, hearing directly from Black maternal mothers will shed light on how healthcare practitioners are treating Black maternal mothers. I really want to stress this. We need to be able to hear from patients to improve the system that is meant to serve them. 2, diversity and inclusivity training in medical schools are subpar. So, to answer these questions and test these hypotheses, I decided to do a qualitative study of my own. I had 2 focus groups in this study, Black maternal mothers and medical students, and both of those groups were sent a questionnaire, and I asked Black maternal mothers about their experiences in the healthcare setting when giving birth to their child, when they were pregnant, and a little bit after. And I also asked medical students how they felt about their education in school, and if it had adequately prepared them to treat culturally diverse patients. The purpose of doing a qualitative study is, again, to share Black women's stories. There's not many of them out there that actually focus on Black women and the care that they're treating, but also I wanted to understand the training that's actually happening in medical schools for diversity, equity, and inclusion. As of right now, there is no standard diversity, equity, and inclusion training for medical schools. Just this past year, the Association of American Colleges released kind of like an addendum that was titled New and Emerging Areas in Medicine, Diversity, Equity, and Inclusion Competencies Across the Learning Continuum. This is new for the AAMC, and it was just published last year. There is no standard right now, and I wanted to explore how some medical students felt about their education. So first I'd like to go through the results of the Black maternal mothers. I got 7 mothers to answer my questionnaire, and I found a couple of interesting themes when in their responses. So the first theme that I really focused in on was their positive experiences. This quote by B really sums up how the positive experiences that almost every single mother had with their healthcare providers. It says, "My doctor was awesome. She always listened and always took everything I shared seriously. I felt safe with her." And the 2 words that I want you guys to focus on in this quote is listen and safe. Most often when the mothers talked about if they did something, if the doctor made them feel comfortable, if they felt safe, is when the doctor listened. When the doctor listened to their concerns, when the doctor answered questions about what was going on, and when the doctor offered extra knowledge on how to care for themselves and their baby. Also safe. Many of the mothers, when positive experiences were described as safe experiences, they were described as experiences where the doctors gave them empathy and made sure that they felt comfortable, because this is a very scary time in a woman's life, but it can also be very exciting, and the doctor can play a very big role in shaping how they feel about their experience. On the flip side of this, there were common themes among the negative experiences as well. And I'd like to break this quote down with you guys. So this lady decided to remain anonymous, so we're just going to call her Miss Anonymous. And Miss Anonymous said, "The biggest issue I recall was being told I was too fat and gaining weight too quickly, even though I hadn't increased my daily intake." So here is An example of a plethora of things, really. First, they're not listening to her. She's saying she's not increasing her daily intake. They're saying she's too fat. There is no conversation or dialogue in here about why she's too fat, how she's getting too fat, or even how it's going to affect her pregnancy or her baby. All she's being told is you're too fat. Next, she says, I was also told I wasn't in labor and almost sent home. My water broke at that very moment. Can you imagine knowing something is going on with your body, telling your care provider that's supposed to keep you safe, keep you healthy, and help with your baby that you know is coming, and being told you need to go home? She's clearly not equipped to have this baby by herself at home. She's at the hospital for a reason, but the care providers still weren't listening to her. And if her water didn't break, she probably would have had the baby at home. Lastly, she said the last thing was getting an episiotomy without being told prior to their pregnancy. For those of you who do not know what an episiotomy is, it's when the mouth of the vagina is cut during birth to help the baby come through. And this is actually, unfortunately, a very common practice in teaching hospitals. So there are cases where it's necessary, where the baby can come through and they need to cut it, but in a lot of teaching hospitals, they will cut a woman on purpose so that medical students can come and learn how to sew them up. And this is what happened to this woman. She was not told that this was going to happen to her body, and it happened anyway. And sadly enough, this is something that is very commonly happening to Black women, especially because Black women, not always, but some of them cannot afford to have a private doctor and do not have medical students being the ones doing their care. As far as negative experiences as a whole and what I looked for in my participants, this was common. This not knowing what's happening to their body, not knowing what's happening to their baby, asking questions and being ignored, was something that always lended to having a negative experience. My third theme is non-definitive experiences. So interestingly enough, I asked these mothers, did the race of your care provider play a role in how you were treated? And it did not always play a factor. Some of the women said yes, but for this pregnancy and not my second. Some of the women said no. Some of the women said maybe. So there was no real consensus on whether the race of the person that was treating them actually played a role, but what they always remembered was how that person made them feel. One woman even said, I do not remember the race of my provider, but I remember that she made me feel safe and she made me comfortable when birthing my baby. This goes to show me that we can teach this. We can teach people how to make other people feel safe. When the women were asked, what would you tell future doctors, and what would you want medical students to know? The biggest word again was just to listen. Listen to concerns, be empathetic, be compassionate, and actually take the time to make sure your patient is doing okay. So for the medical students, I only had 3 respond, but so I wasn't able to come up with as many themes for them. But what I was able to notice was one common thing. They had one thing in common. All of them felt as if they were prepared to treat culturally diverse patients, but none of them agreed on how they had gotten there. So this first medical student named Jay said, I feel that the sessions we took part in gave me the background I needed to care for patients of different cultural backgrounds, though I wish I had more opportunity during my 3rd and 4th year to work with patients of different backgrounds. So this goes back to what I was talking about before. We only do diversity and inclusion training as well as ethical training in medical schools during the first 2 years, and that is not enough for many of these students. The second student said, I do not feel as though my medical school education prepared me well. I feel fortunate to have attended an undergraduate institution which encouraged and built environments with a variety of cultural backgrounds. So here, they don't feel like their medical school prepared them at all. And what that tells me is we need a universal way to make sure that students are getting the education that they need, because America is not one color. America is many colors. And our medical students need to be able to treat everyone that they come across in a culturally competent way. So there were a few limitations to this study, namely the fact that I only had a couple weeks to collect data and I only had a few participants, 7 in the maternal mothers and 3 in the medical students. But despite that, I was still able to come to a few conclusions. The first one being, medical schools should use Black women's stories in teaching students about how to care for Black women in the maternity ward. So again, how do we learn about what patients need if we're not talking to patients? There is too few studies done that actually take into account the care that patients are getting and their opinions on the care that they're getting. Additionally, more qualitative studies are needed to help train our future physicians. What's so interesting about the documentary that I told you about earlier, there is a roundtable discussion between a bunch of medical students at Harvard and the husband of Amber Isaac Rhodes. And one of the students, it really struck me. She said, if you had never came and spoken to us, I would have never thought about these things, and I would have never implemented them in the way that I can now when treating women like your late wife. And so that just tells me, like, we need to make sure that our medical students are learning about these things. It's no one's fault that they don't know about it, but it is, as a collective, we need to create these competencies for medical school. So in conclusion, America is not the safest place to have a baby, and it's even more dangerous when you're Black. But with studies like this one, I'm hoping that we can start educating our medical students and creating future physicians that are able to keep our Black maternal mothers safe. I would like to thank Dr. Varner, who inspires me to do my best work every day, Dr. Wolf, who made the honors experience at St. Edward's unforgettable, all the participants for taking the time to answer my questions and sharing their stories, my family for being my love and support throughout these 4 years. I know Joanna Trimble's not here, but I would not have done Cultures without her. I didn't get it. And all of my friends for keeping me sane. I love you all. Thank you.
For sharing your research. I open it up to the audience for questions or comments.
You said that you also want to work in the medical field in the future, and I'm wondering what you see the possibility for peer education changes as well. Obviously, there needs to be something done to standardize the advocacy for Black mothers in the healthcare system. But do you think there could be a change as well, and what opportunities you see for peer education for doctors that are working with mothers and patients?
Yeah. So this is an interesting question because personally, I feel as if that when I get to med school, I will be advocating for Black mothers, and I will be making sure that I am an anti-racist, and just also like making sure that the people around me know about the things that I know about, and know, like I'm going to be a teacher because that's just part of who I am. But what I will say is that it's very exhausting for a lot of people to have to be the advocate for everyone around them, especially because a lot of the time I'm the only one that looks like me in the spaces that I'm in. So when I'm already taking on the role of student and I'm already getting through my own classes, and now I have to take on the role of teacher to make sure that the people around me are, also being anti-racist. It's a job that I want because it's a job that I care about, but I don't think we should, there's opportunity for peer education, but peer education should not be the norm. That's why curriculum is going to be so important, because we can't expect every Black person in medical school to want to be an advocate for every other Black person, every Black patient that their peers will see. Is that
I'm curious where you did your study and your analysis collection. What part of the United States did you particularly look at, or was it just Texas?
I actually didn't get many from Texas. It was more of like convenient sampling. So my mother is Black and all my friends are Black. So all the people that answered my survey as far as the Black maternal mothers were just kind of like my mother's friends, and most of them, almost all of them, live in California. But as far as the medical students, I reached out to a contact that I knew in California. I also knew someone who goes to Stanford who's in med school right now, and then I had a few friends around here who just have like brothers and sisters in medical school, and so those were the people that I reached out to. There was no kind of like section, although I did think it would be very interesting to look at schools in California and maybe look at schools in Texas and compare that kind of, like if there's a difference in diversity and equity training, because of course also different medical schools serve different populations, and they might be kind of more like focused on the population that they serve as well.
So you mentioned that there's no real like standardized training program right now in medical school. Did you find anything in your research or based on your results on like what you feel like a good training program would look look like, or like what are some key elements?
So I did find this really interesting study, and but it was for a hospital. And so they did they had these objectives that you had to hit, and they did it was kind of like different talks that people had to go through, and everybody in their hospital had to learn about it and show competency in it. And I think something like that would be really interesting, where it is more of a discussion and round table. That's why I feel like qualitative studies would be great, because then you can actually learn from people's stories as well. But that hospital kind of did it like that. They learned from their patients and they talked about it with their staff. And I think that would be really good in medical school as well.
We have time for one more question or comment.
I do think this topic is very important because right now training is very reactive in working in healthcare. You know, we are getting trained, but it's almost training as a result of something, right? And so taking that initiative, that proactive initiative in hospitals is great because it's not just the physicians, it's the moment you walk into getting your health care. So it's the registration person all the way to the surgeon. And so it's a good study. Keep going with it.
Let's give Saida. Dr. Terry Varner to say a little something about working with Saida, and I'd like to make Saida Towns get stoled and courted.
Well, first things first, let's get the cord and the lapel around. She doesn't know what I'm going to say. When I first got the email request, would you consider being my advisor for this particular project? And I read the title, and I thought, this is a scientist coming to a professor that's not in her department. It's not in the School of Natural Sciences. But the interest for me was that this was a qualitative study, and it was going to be examining Black maternal mothers as well as medical students. My year working with you, Saida, has been, I would say, one of the most engaging, informative, and just watching your work ethic has been amazing to me. You are a student athlete. You are a member of a number of different kinds of organizations, for example, PSA, but I know that you have your own organization. But I remember, and I don't do this often either, sharing my personal cell phone with my undergraduate students. And I thought, this is either going to go really well for me or really, really bad for her. And I remember when you were sharing your literature with me, I was just so upset. And I had no idea about how much I didn't know about this topic until you brought it to my attention. So I would say, I am so proud and so honored, and by the way, yes, you nailed it. I was in the back. Everything that we have worked on, it has been flawless